Okay, hello, and welcome to Creating a Culture of Compliance. My name is Lance King, and I am the Vice President of Sales within our culture at Healthcare Compliance Solutions. And today I will be presenting and will answer any questions following the presentation. And here is my contact information you can jot down real quick. Now, this presentation will address HIPAA, OSHA, Medicare, HR, and audit planning in the following format. It's important to note that the objective of this presentation is to assist practice administrators in creating a culture of compliance. Now, this will involve leaders to understand the regulations and how to implement them adequately and effectively. And we realize you're very limited in the time you can allot for a compliance program. And I think this presentation will provide a sound framework of how you can move forward. Note that it's not a complete training on any one healthcare standard in its entirety. And so further recommendations can be provided should you request assistance. Now, to start off, I want to illustrate the first section with a video. So make sure you have your sound on. Concentrating on something else. And a couple of things to note about this. First, compliance can be compared to a 200-pound gorilla. Compliance isn't the most popular topic, but it is the law, and we do our best to help practices comply. Second, following the basketballs can be compared to having a focus that is an acute focus on a specific task. Now, we tend to overestimate our ability to do several tasks at once while thinking we're also surprises or other details that may surface during that task. Would you agree? And so the question is, what are we doing while handling patient information? And what are the implications on other people if we aren't focused on one thing at a time? Again, you might agree that we all have an inflated impression on how we focus on things that are important. Now, moving on, this is a very important topic, creating a culture of privacy and security. This is one of the biggest challenges that is facing healthcare providers and business associates today. And privacy and security, we would argue, are best achieved when the overall atmosphere in the offices emphasizing confidentiality and of patient information. And so the leaders that really set the tone in creating this culture are going to do three things. The first is consistently communicate your expectations that all members of your workforce protect patient health information. The next is to guide your staff as leaders, to guide them on how to comply with, how to implement, and then enforce your privacy and security policies and procedures. Lastly, remind staff why keeping health information, confidential, is important to patients and to your practice as well. This should be something that you do in staff meetings as well as when an opportunity to instruct presents itself. And that happens more often than not. Again, it's about understanding the compliance standards so that you can identify with how to help your team. So first, what is HIPAA? Well, as we probably all know, HIPAA is Health Insurance Portability and Accountability Act. Now, it's very common that practices are worried about having a HIPAA breach. And so what does that look like? Well, suppose a member of your office staff just accidentally mailed out the appointment list for the day containing patient names, dates of birth, social security numbers, and phone numbers to another patient along with their new patient packet. What do you do in this circumstance? Few questions. Does your staff know who to go to for leadership when there is a HIPAA breach? Does your designated HIPAA compliance officer know all the necessary steps to take in breach notification? Last question. Does your HIPAA compliance officer know where to receive guidance? These are things that are paramount and absolutely should be taken into consideration. Congress has created extensive breach notification requirements as part of the HITECH Act. And so after a breach is discovered, the provider must do some specific things. And you'll want to take notes on this. There are 6 specific things that happens pretty regularly. So you'll provide notification to each individual whose PHI was breached within 60 days. And the notification includes a brief description of what happened, date of breach, and date of discovery. Next, a description of the type of PHI involved and the steps the individual should take to protect themselves from any potential harm. Next, a brief description of what the office is going to do to investigate, mitigate losses, and protect against future breaches. In this, you should include contact information for individuals to ask questions or obtain additional information. Next, provide written notification via first-class mail or email if that is the preferred method of communication. And then the last 2 things to consider: you'll need to notify prominent media outlets when the breach involves PHI of 500 or more individuals, and then report all breaches to the Secretary of Health and Human Services. And this is required with all breaches. Again, all breaches should be reported. So make sure that you understand them so that you're not blindsided should an auditor come in and extend a finding or a fine. And again, your awareness, it's king in this effort. Next is identifying a breach. So a breach is generally an impermissible use or disclosure under the privacy rule that compromises the security or the privacy of protected health information. HHS's definition of a breach is, quote, an impermissible use or disclosure of protected health information is presumed to be breach unless the covered entity or business associate, as applicable, demonstrate that there is low probability that the protected health information has been compromised based on a risk assessment of at least the following factors. Take a minute to go through these 4 factors. The nature and extent of the protected health information involved, including the types of identifiers and the likelihood of re-identification. The second is the unauthorized person who used the protected health information or whom the disclosure was made. Next, whether the protected health information was actually acquired or viewed. And then finally, the extent to which the risk to the protected health information has been mitigated. And covered entities and business associates, where applicable, you have discretion to provide the required breach notifications following, as it says, an impermissible use or disclosure without performing a risk assessment, and that's to determine the probability that the protected health information has been compromised. So please note that. There are 3 exceptions to the definition of breach. The first exception applies to the unintentional acquisition, access, or use of protected health information by a workforce member or person acting under the authority of a covered entity or business associate if such acquisition, access, or use was made in good faith and within the scope of authority. Number 2, the second exception applies to the inadvertent disclosure of protected health information by a person authorized to access protected health information at a covered entity or business associate to another person authorized to access protected health information at the covered entity or business associate, or organized healthcare arrangement in which the covered entity participates. And in both cases, the information cannot be further used or disclosed in a manner that's not permitted by the privacy rule. The third exception applies if the covered entity or business associate has a good faith belief that the unauthorized person to whom the impermissible disclosure was made would not have been able to retain the information. So these are 3 very important exceptions to a breach. So some key components of the HIPAA privacy rule, some HIPAA protections. We'll go through these pretty quickly. First, we'll actually go through about 9. First is to help ensure the privacy of protected health information. Next, give patients more control over their health information. Establish appropriate safeguards that healthcare providers and others must achieve to protect the privacy of health information. Hold violators accountable, and that's with civil and criminal penalties that can be imposed if they violate patients' privacy rights. The fifth one is to strike a balance when public responsibility supports disclosure of some forms of data, for example, to protect public health. Enable patients to find out how their information may be used and about certain disclosures of their information that have been made. Limit release of information to the minimum reasonably needed. Give patients the right to examine and obtain a copy of their own health records. And lastly, empower individuals to control certain uses and disclosures of their health information. And that last one kind of encapsulates this slide. So the HIPAA protections, the HIPAA security rule puts into place 3 things: physical, technical, and administrative measures to protect patients' health records. The second is focus on internal and external security threats. And this includes breaking through network firewalls, email attacks through interception or viruses, compromise of passwords, and computer viruses. The third is assessment of and preparations for security risks in hardware, software, facility, and environment. And at this point, you may feel that you're going to have to conform to every detail within these healthcare regulations. Don't worry. I'll share some recommendations that will provide some flexibility and help further clarify your boundaries. So 7 steps. The first, understand the rules. Review the regulations and learn about HIPAA. That's the bottom line. Second is assign responsibility. Appoint a compliance officer. Again, you're doing so much already as practice administrators. If you can, assign this responsibility. And then list created of your EPHI and identify your information systems. Number 4, conduct a risk analysis where you'll assess vulnerabilities, prioritize your risks, and then identify your security measures. Number 5, implement policies and procedures. And this requires you to document all policies and procedures, document methods to address the security policies, and select security controls that match your policies. Deliver a compliance training program. And this means you'll train all employees, including doctors, and document the training. And this should be an ongoing training process, not just a once a year. Auditors want to see ongoing training that's documented. And then 7, monitor and document ongoing HIPAA progress and compliance. Make sure you do internal audits, you monitor and you test your privacy and security programs, and integrate any privacy complaints and any security incidents, constantly allowing this program to become a force for continuous improvement. So within security risk analysis, there are 3 main things. First is to identify where PHI exists in your practice and how it is created, received, maintained, transmitted, including in your EHR, okay? And types of risks to the ePHI maintained in your EHR, they really will vary depending on whether your EHR is based in your office or whether it is hosted online. Number 2, identify the potential threats and vulnerabilities to PHI. 3 specific areas: human threats, natural threats, and environmental threats. Human threats include cyber attack, theft, or workforce member error. Natural threats such as earthquake, fire, or tornado, and environmental such as pollution or power loss. Vulnerabilities are the flaws or weaknesses that, if exploited by a threat, can result in a security incident or a violation of policies and procedures. So keep that in mind. Third, identify risks and their associated levels of high, medium, and low. That's the next step. This is done by simply assessing the likelihood that the threats will exploit vulnerabilities under the safeguards that you currently have in place, and then by assessing the potential impacts to confidentiality, integrity, and the availability of PHI. So what's the game plan? Well, moving forward, as mentioned, start by having, after you've appointed a compliance officer, have your HIPAA compliance officer assess the potential shortcomings in how the practice protects the patient information, and then discuss those findings and the solutions together, but also include your EHR developer. And of course, keep the documented results of your analysis in a compliance folder. And this can be a great thing to measure where you've come from and to use it for constant analysis. So 2 specific things that I want to say in this regard about a risk analysis. Risk analysis can produce results that can fall into gray areas. It's important, though, to know you will be able to see where you are meeting, not meeting, or exceeding HIPAA requirements at a given point in time with a risk analysis. So take advantage of the flexibility that the HIPAA security rule provides, where it allows you to achieve compliance while taking into account the characteristics of your organization and its environment. That's really key. You're not going to have to do everything that is required by the regulation, because you are your own unique entity. So make sure it's feasible and make sure it's affordable for your practice. And then the next thing I'll say about this, over time, your documentation folder is going to become a tool that, as I mentioned just briefly, it'll help with your security procedures, just helping them become more efficient. And your workforce will also be able to reference this as a master file of security findings, decisions, and actions. And these records can be essential if you're ever audited for HIPAA compliance or any HR incentive program. So just some tips. I'll just be real brief on some tips for a better security risk analysis if you're already conducting, or if you're in need of knowing where to start. First, educate your staff about the iterative and ongoing nature of the security risk analysis process, so they're not surprised when you're regularly doing it. And then make security a high priority in your workplace culture, which, again, this is what we're discussing. Have an action plan that clearly assigns responsibility for each risk analysis component. Involve your EHR developer, as I mentioned, and ensure the risk analysis is specific to your practice. Okay, so that's just kind of a brief overview of what we've been mentioning. So then some precautions to consider. Some low-cost, highly effective safeguards. The first is to say no to staff requests to take home laptops or any other portable devices that contain unencrypted ePHI. This is a huge problem, and I'll talk more on this in a minute. Remove your hard drives from old computers before you get rid of them. Do not email ePHI unless you know the data is encrypted. Make sure your server is in a room accessible only to authorized staff, and then keep the door locked. Make sure that the entire office is well aware that passwords should not be shared or easy to guess. Next, notify the staff that, again, that you're required to monitor their access randomly, and this will build a lot of trust with them. They won't feel like they're being singled out. Maintain a working fire extinguisher in case of a fire. And then lastly, check your EHR server often in case there is a virus or malware. You want to make sure you can detect and get rid of it quickly. There are constant questions asked about social media by several different practices. And so to ensure you maintain HIPAA compliance, create some policies. The first we would recommend is to access controls, to access controls of your practice's social media pages, meaning keep the login information limited to the minimum necessary staff members. Second is limit or prohibit staff from accessing their personal pages while at work. Third, prohibit your staff from linking personally to a patient's profile page within a social media platform. And the fourth, requesting a signed HIPAA waiver. HIPAA puts the burden of preserving patient privacy squarely on the shoulders of the provider, but an individual can't always waive those rights. So having a simple waiver form that's available for your patients will release the healthcare provider to share patient information for marketing purposes, is typically what it's for, and that'll satisfy the necessary documentation. And then, of course, train all members of your staff on the policies and then lead the culture in following the policies and procedures to help protect everyone. So as far as training is concerned, we've talked a little bit about this. Online and in-office training are typically, they're becoming the most popular ways of training. But then you've also got outsourced with consultants. Training in HIPAA privacy and security is mandatory. It needs to be documented and it needs to be ongoing. We mentioned that. So enable your compliance officer to gain a full understanding of all of these rules and allow them time for training to understand their role. Now, employees must also be given, other staff must also be given adequate time to train and understand their responsibilities in EPHI. And as training's completed, make sure it's documented and kept with the other compliance documentation. As far as the three options, it's just important to consider how much time it's going to take to prepare a training course and to train your staff. We recently spoke with an office manager who's in Idaho she mentioned she was trying to develop her own HIPAA compliance training for staff. And she had scheduled a block of time to work on the training, but every time she sat down to write it, she said she was interrupted. And after multiple attempts and several months of clicking snooze on the Outlook calendar reminder, she still had no training course. And in-house training, it can be costly financially and a huge time investment. For practices that are just beginning, if you were to hire a lawyer to prepare a customized program, it could cost somewhere in the neighborhood of $20,000 for a complete program. So that's why a lot of companies are considering online. And at any rate, there are many variables to consider. And even with online, just because it's least expensive, oftentimes people can say, oh, well, I've got account information, login and password for everybody. We just have to go in and do the training. And then all the information's printed out in our setup that creates our policies and procedures. And we've got a manual, and so we're good. But the problem is people get lackadaisical. They think, oh, this is so easy. So they put off the training. And so with online training, the fault is, if you don't set a date and work backwards from it, online training isn't necessarily the best option. So just consider and weigh your options, but know that training is required annually. So more about compliance training, and I'll just be brief. As far as your culture is concerned, this should be an ongoing thing where, again, people that are hired or contracted should go through training, and doctors, nurses, employees, volunteers, trainings, and contractors supporting your office. These should all know how to safeguard patient information in the practice. And so just a few quick things. So yearly retraining, important to consider. Anytime you've got changes in policies and procedures, you'll need to train staff, your systems, location, or infrastructure. or when responding to a breach or a disclosure. And this is actually a really important time to learn as a practice. Oftentimes there was an unconscious incompetency where people didn't know. It's when you don't know what you don't know. and truly, there's so much instructive time that can come after a breach. And so anyway, these are a few things to consider with ongoing training within your culture. In addition, we've talked a little bit about documentation. Documentation of risk analysis and HIPAA-related processes, policies, procedures, reports, and activities is a requirement under HIPAA. And then also, it should be mentioned, the Centers for Medicare and Medicaid Services, which they're called CMS, so that's all we'll refer to them. They advise all providers who attest for the HR incentive programs to retain all relevant records that support attestation. So just some examples of records to retain. Make some notes. Your policies and procedures, completed security risk analysis, training materials presented to staff and volunteers, and certificates of completion, current business associate agreements, EHR logs, and those should show both utilization of your security features and efforts to monitor users' actions. And then two more, risk management action plan or other documentation that shows appropriate safeguards, implementation timetables, and implementation security incident and breach information. Now, within policies and procedures, we're going to drill a little bit deeper into this. So with respect to protecting patient and healthcare workers, your policies and procedures, they really are a guide to how your practice operates on a day-to-day basis. Your medical practice policies and procedures should at minimum accomplish the following, and there's 6 things that I'll talk about. First is just to establish the protocols for HIPAA, OSHA, and Medicare. The second is commit to a compliance training program for all new staff when they're hired and on a regular basis for the entire workforce. And we also talked about contractors and volunteers being included. Third is instruct your workforce on what to do when something happens that impairs the availability, integrity, or confidentiality of EPHI or any safety incidents. Fourth, looks like I've already got that up there, specify a sanction policy for the violations of privacy, security, or breach notification rules, or your policies and procedures. So have all of those specified for your practice. And of course, the sanction policy must be applied consistently as it is written. Now, detail enforcement is the next, and that starts with the use of your EHR security audit logs to monitor the access, use, and disclosure of EP, and specify the need for written agreements with business associates that can detail their specific responsibility to comply with the privacy and security. Oftentimes, they may not even be as aware. So make sure you sit down and take time to create that. So now with employee HIPAA, privacy, and security, just a few guidelines. So employees and visitors should wear some sort of identification, badges, a name tag. Next, it's important to speak softly and or use non-public areas when in order to maintain this culture of privacy and security when talking, of course, about PHI. And then only access PHI on a need-to-know basis in order to perform your job. That's pretty simple, and I'll have a story in just a minute that that illustrates one of many circumstances where that has been violated. So need to know basis in order to perform your job, very important. So some simple steps to take at the workstation to promote privacy and security. And there are 5 here. The first is just to keep the documents with PHI out of unauthorized view. Next is PHI should be shredded or disposed of in a secure container. And then workstations and computer monitors, you should actually position them so that they prevent any unauthorized view. Of course, protect user IDs and passwords. And computers automatically return to a login screen by the user when they're not in use. So access, HIPAA privacy and security, controlling access to certain areas in the office, it's going to promote the minimum necessary information that staff is going to have access to. A couple things in this regard, some guidelines. First is to access the computer room. Access to the computer room should be restricted to unauthorized personnel. Backups of PHI are secured in a safe area offsite or not near public areas. Copiers, fax machines, and printers are limited to authorized staff. And lastly, office doors, filing cabinets, and desks are closed and locked when unoccupied. And an alarm should be set for the building after hours. So within environmental HIPAA privacy and security, and again, with all these things has been said, I believe Benjamin Franklin said, by failing to prepare, you are preparing to fail. So that's why it's important we're reviewing these things. So some guidelines for the environment. When your office is ready for an emergency, the first is smoke detectors and fire extinguishers are operational and accessible. The second is computer equipment plugged into surge protectors, and where appropriate, if you can find an uninterruptible power supply, that's the best. Cybersecurity needed, whether EHR is locally installed or accessed over the internet from a cloud service provider. And then lastly, an action plan for access to the PHI in an emergency situation. If you fail to plan, you plan to fail. So keep that action plan. Okay, OSHA.